Well, hello and welcome, everybody. Thank you for joining the HealthiestYou monthly national webinar. My name is Scott Sanford here. I'm the co-founder and chief growth officer. I'll be hosting the webinar today with Colin Sawyer, who is based in Texas as one of our external business development managers. Many of you probably spoke with him or met with him, but thank you, everybody, for joining the call. Today, our title of the call is Giving the Gift of Health. Since it is December, the holidays are here already. I don't know what happened to 2015 or how we got to December this quick, but we are here. The holidays are here. It's a great time to talk about health and benefits and insurance and how we resolve our healthcare issues and whatnot. And today what we have planned is we're going to walk you through the HealthiestYou product offering, what that is. So this is your first time joining the HealthiestYou call and the first time hearing about this. We greatly appreciate you joining us today. We're going to give you a quick overview, show you a new demo of our new technology that's creating waves out there in the healthcare space, which is our smartphone and handheld tablet app for resolving healthcare issues. Very, very exciting. I also want to just thank everybody on this call that are existing producers and distribution partners with us, as HealthiestYou has had an incredible year. I'm sure you saw the announcement out there. We brought on a new capital partner here with a $30 million investment into our company to continue to grow, create the tools that you all need out there to share this with your clients and clearly explain how this changes the way claims come in and out of a benefit plan, how we reduce the claims, how we simplify care. So we're very excited to continue this massive growth phase and add more resources for you here in the end year of 2015 and 2016 and beyond. So thank you all for your support on that. With that, I think let's go ahead and get started here, and I'll do a quick introduction of HealthiestYou and then pass it over here to Colin, who's going to walk you through the product. But for those of you that are new, HealthiestYou is really designed to just simplify healthcare for people. It can be confusing and steer them down the most efficient path to care so they can save money, they can save time, they can save resources, and keep those unnecessary claims out of the health plan that continue to drive up these costs for everybody in healthcare. We know we've got some company admins on the call too. It's tough, brokers as well, when you got to meet with your clients and say, well, we only had a 10% increase in your healthcare spend this year. That's tough to do that year and over and over every year and have to deal with that. So we're here to put in some tools and things in place that make healthcare more efficient. Now at the end of this call, for those of you that are attending, we're going to draw 10 names from this list. Jesse here, many of you know Jesse at HealthiestYou. He's taken the names down. We're putting them into, think of bingo night, right? We're spinning this thing around. We're going to draw names at the end here. 10 people are going to get a family membership for a year that you can give away to a family in need. Maybe they might be struggling, or maybe they've got a lot of healthcare spend going on. You can gift that to them as a nice gift here for the holidays. You can keep it for yourself if you want one. You can give it away, but we're going to draw 10 names at the end here for people that are getting it. It's a $180 value for one of these family memberships for a year. We'll get into that here in a moment, but very excited about that. So let's continue. So HealthiestYou, we like to draw a comparison to some other companies out there because business is changing. And the question is your business changing with everything that's happening out there with technology? If we look at Airbnb, the largest accommodations provider in real estate, owns no real estate whatsoever. Facebook, the most popular media owner, creates no content. Uber, the world's largest transportation and taxi company, doesn't own any vehicles. And HealthiestYou fits in that category. We're known as the consumer engagement and the claims reducer in health plans, but we don't own any clinics or any doctors. We just engage that consumer, let them know their options, and connect them with the appropriate care when needed. So really that first platform that shifts consumers from those expensive and inefficient healthcare endpoints, we do that by putting the consumer right in the middle of their options. So, but first off, we meet them at their comfort level with technology. We all have clients, family members, friends, groups that maybe they're not comfortable with technology. Maybe they're a little intimidated by that. That's okay. If they can dial a phone, dial our 800 number, We'll connect them with the doctor, get their issue taken care of. We'll help them. For those of us that are embracing technology, maybe we've got those iWatches or the apps that make our lives easier on our smartphone or our tablet. We've got awesome technology there where you can connect. You can see lots of details around your healthcare benefits and make decisions. Of course, we got our basic web access to online. Log into your private member portal and access everything HealthiestYou has to offer. We have a big push in our couch care initiative. We're going to smart TVs. Every TV that's sold now it connects to the internet, and they have apps on there. You can download Netflix. You can do all these neat things. Well, why not download the HealthiestYou app right on your TV? You're laying on the couch, you're not feeling well, right? Fire up the app, check a deductible, maybe find a provider, or schedule a telehealth consultation right there from the comfort of your couch and get that issue taken care of. So we centralize all your healthcare options. Right? First thing we do is we connect to your health insurance provider so you can see your deductible. Maybe you want to know where your deductible stands because you've got a procedure coming up. Click one button on our app and you can see that. We'll show you here in just a moment. You can price procedures. Doctor says you need to have an MRI done. Well, I'm on a high deductible. I got to pay out of pocket. How much is this going to cost me? Is it $500 or is it $5,000? I don't have any idea. We'll let you know here at the push of a button with our app. You can locate providers. Let's say you've got to do that well visit at your primary care physician, or you moved, you need to find a new primary care physician. Look up the provider search right on our app. You can find in-network doctors based on your health insurance coverage, whether you have Blue Cross, Aetna, UHC, doesn't matter. 170 different payers loaded in there. Find providers with some nice data around those providers to help make a decision. Of course, we have our 24/7 unlimited doctor access. Phones are ringing off the hook this time of year. You can hear my voice, right? I've got some of this cold stuff going around. People are calling left and right for allergies, infections, sinusitis, all kinds of great things. Calling in, getting connected with a doctor, getting that issue taken care of right over the phone. No need to go in. We have our health management content. We want to keep you focused on being healthy, staying out of that doctor office. Here's some tips. Here's some videos for you to reference. And then we want to help you find the best prices on that medication. We got a great testimonial coming up here from a member who used the app, saved a ton of money on one medication versus pricing it with her health plan, because we make it easy for you to do that. So next I want to go ahead and pass this over to Colin Sawyer, and he's going to walk us through the product offering. Colin, it's coming over to you, buddy.
All right, Scott, appreciate it. So can everyone see my screen?
Looks like it's still loading on mine. There we go. I can see it on mine. So let's assume we're ready to go for everybody else.
Perfect. So I'm basically going to start, with our telehealth offering here. Of course, 24/7 access to doctors. And this little stat by the Wellness Council of America just basically shows that over 70% of all ER, urgent care, and doctor's office visits can be safely handled over the phone, and that's what we address here every day at HealthiestYou. Here's just a stat or just a comment that really shows the growth here of telehealth here in the coming years. And just as a report last year by the consulting firm Deloitte projected as many as 300 million e-visits within a few years, compared with just 800,000 by the American Telehealth Association expects in 2015. So it's only going to grow from here, and so it's a great time to get in on the ground floor. So here's just kind of just touching on claim redirection. Obviously these are the costs, at the average cost here at a primary care, urgent care, and ER. You're looking at $125, $175, and $1,200 respectively. And of course, with HealthiestYou, it costs nothing to call our doctor network. You don't have to wait in a wait room. There's no travel time. You're not taking time off work to go and visit a doctor. And we're available 24 hours a day, 7 days a week. So we're always here to help address those acute illnesses over the phone. And here are the top 9 reasons why we all visit the emergency room. And as you can see, they're pretty small issues in the grand scheme of things. And people are actually going to the emergency room to address all these issues, things like allergies, pink eye, sinusitis, urinary tract infections. So we're trying to redirect as many of these claims away from these emergency room facilities as possible. And with our telehealth network, they're all board-certified licensed physicians that reside in the United States that are able to diagnose, treat, and prescribe medications. We do have the largest telehealth network in the country with over 2,300 doctors. And again, it's all 24/7, 365 access. And we have a no consult fee model, so members are able to call as many times as they want for free. And here's how the member experience works. You can call HealthiestYou, or you can schedule an appointment online or on your smartphone app. From there, you provide your medical history, not unlike you would in a regular doctor's office. From there, the call is scheduled with the appropriate doctor in the state that you're currently calling from. From there, the doctor reviews the online patient history and calls the member. And then if a prescription is required, they'll send an e-script to that member's pharmacy of choice. From there, the doctor updates the electronic medical record with consultation notes. You can even share those notes with your primary care physician if you choose. And then finally, your consultation notes are stored in your HealthiestYou member portal for up to 7 years. And here's just some survey statistics. 97% report customer satisfaction. 94% of patient medical issues are resolved in that first phone call, meaning that no further action needed to be taken from there. 9 minutes is the average callback time from a doctor, so it's a very quick turnaround time. And 13 minutes is the average consult duration. So you can, in theory, get your call the doctor network, get your consultation done, and get a prescription within the hour if things go well. So it's a very quick turnaround time, and it's obviously much more time efficient than going to see an actual doctor. We have a 95% client retention rate, and once again, free consultations for all of those members. So now what I want to touch on is our phone app, and first thing I want to talk about is before I get into a live demo of our phone app, is our geofencing reminders. So anytime that you walk into an urgent care center, for an example, you're going to get a push notification on your phone just saying, hey, it appears you've walked into an urgent care center. Remember that you can connect with a doctor right now via phone for free. So this is just another last-ditch effort to really engage those members to really to make sure that they have that they know that they can call a doctor instead of going into the urgent care center in this case and having to pay those co-pays and all that good stuff. We also have the same technology for pharmacy. So anytime you walk into a pharmacy, you're going to get a push notification on your phone just reminding you to check out your prescription drug price comparison tool, because it's going to, on average, save you, it's going to beat your pharmacy copay roughly 7 out of 10 times. So it's just another way that we're saving folks money and redirecting those claims. So with that said, let me go ahead and bounce out right here really fast and open up my phone app so you guys can actually see my phone. All right, so I hope everyone can see that there. So when you first download our app, you're asked to go ahead and plug in all of your insurance information so that your phone, like Scott was saying earlier, is going to be actually synced in with your health plan. And the first screen you're brought up to is what we call your radar screen. And what your radar screen does is it brings up all the TCPs, urgent cares, ERs, pharmacies, and even veterinarians in your immediate area. And we include veterinarians because in the future we're actually going to also include pet telehealth. So we want to be reminding people to keep coming back to using HealthiestYou, and so just kind of a wellness place for the whole family. Now, as you can see with these little icons right here, you can actually click on these little icons and actually get information about doctors before you even go in and see them. So just for example, Dr. Candace Gibbon right here, I can click on details, and it's going to bring up basically her background, her locations, and her contact information, also where she went to school. So again, you can also just become a smarter consumer of your health care before you even go in and see these providers. And you can also click on this little heart icon up in the top left-hand corner of your screen, which is not seemingly working for me right now, but what it does is you can save these doctors and providers to what we call your circles, which is basically a quick access point for all of your favorite providers. And I'll come back to circles here in a moment, so you can just talk to you about that. So when you click on the apps button down here at the bottom, this actually gives you a list of options that you can choose from. You can choose consult a doctor. And this starts the whole telehealth process. You can call, you'll have your number right here, and you simply hit request consult, and the doctor will call you back at that number, of course. And you also have top providers in here. This is basically like the app Open Table, where it's not going to list all the doctors, but it's going to list a vast majority of them. And the good thing is it lists it based on a consumer-rated star ranking, so you can actually see some popular doctors and you can choose a provider based on that. You also can price out prescriptions. As I said earlier, you have your prescription drug tool that saves you, that's going to beat your pharmacy copay roughly 7 out of 10 times. So just for example's sake, let's go ahead and use Lipitor as an example. Obviously a very popular drug. It's going to pull it up here. It's going to automatically default to the brand name, so it's going to be more expensive, of course. But you can also control the dosage and the quantity in here. But if you go ahead and consider the atorvastatin here at the top, the generic version, it's going to bring up much cheaper options here. It's going to bring up all these different pharmacies, and all you have to do is click on one of these pharmacies. Just click Costco, for example. It's going to bring up a coupon for you. So you just present this to the pharmacist, and that's the amount that you pay. So you can also shop procedures on here, as Scott was alluding to earlier. Just say you needed to search for a brain MRI, for example. You can search for that brain MRI by CPT code, and it pulls it up, and it pulls up the average paid amount for that particular procedure within your given area, and also brings you on the low end and the high end. So you can really get a good idea for the amount that you should be paying for that particular procedure. And obviously, a lot of people don't know that the variance in the marketplace when it comes to procedure costs. So this is just providing more information to the consumer about what they should be paying for specific procedures. And you also have the ability to check your insurance in here. As I said at the beginning, you can you log in all of your insurance information. So as you can see right here, I got a snapshot of my insurance card. As you can see, I'm with All Savers Insurance, and it gives my member ID, my effective date. It also gives me a snapshot of my deductible. As Scott was saying earlier, it gives me up to the minute where I stand with my deductible. And as you can see, I haven't contributed anything towards my deductible this year because anytime I'm sick, I just simply call HealthiestYou. So it's sitting at nothing right now. But anytime a claim is recognized, it's recognized on your phone, and this little half circle fills up on your phone. So you always know at any given point in time where you stand with your deductible. Now I'm just going to move on to circles. As I hinted at earlier, this is just basically a quick access point for all of your favorite providers. As you can see, I have my favorite pharmacy in here saved. So my Walgreens pharmacy here in Plano, I can simply hit the green call button and call my pharmacy anytime I need to. I also have my favorite providers in here. As you can see, I saved Dr. Candace Gibbon earlier that I showed you all on the radar screen, so I can always quickly access her if I need to. So, and you also have, last but not least, you have your history button where this basically tracks all of your movements within your app. So with that said, let me go ahead and bounce back out here and go back to the presentation. So as far as HealthiestYou goes, really what separates us from the rest of the telehealth space is really all about our utilization. Historically in our industry, it's a very underutilized product. You're looking at an average of about 2 to 3% utilization. So that means for every 100 employees, you're only getting 2 or 3 consultations per year. And with HealthiestYou, you're getting 42% utilization, or 42 consultations per every 100 employees per year. And we attribute that to a number of reasons. One, obviously, the no copay system helps because it encourages people to call. With other providers, you might have say a $40 copay, and that just, we feel, discourages people from using it. They just soon go and to their doctor and pay their copay because they might not even get their issues handled over the phone. But we want to encourage people to call us and be that first line of defense. But it's also the way it's the way we engage the member and also those HR departments. We do that better than anyone else does. And this engagement pulse slide really kind of shows you what we do from an HR standpoint. With other providers, it's really kind of viewed as the broker's responsibility to communicate the benefit to the member, whereas we view it's our responsibility. We actually have a third of our company called our client success team that actually works hand in hand with these departments to come up with a 365-day marketing plan. And it all kind of starts here at the beginning of this timeline with the registration and fulfillment process. We provide admin marketing tools, monthly marketing, quarterly reporting, emails. We stick with these groups throughout the entire year to make sure our product is getting enough visibility so that it gets used. And here's a sample of our fulfillment kit. Each primary member gets one of these fulfillment kits, and it comes with a very high-quality personalized membership card. So you always have your ID card on you, so you always have a doctor in your wallet, so to speak. We also provide proactive consumer engagement to these folks. We give them worksite posters, flyers, payroll stuffers, things of that nature. We also have consumer engagement, things like app flyers, app download drives, things like that to get people to download the app. We also have custom campaigns to get people to, we'll have provide a pizza lunch or order lunch for you guys for the HR departments to inform them about about our benefit. So with that said, I think Scott, go ahead and pass it on back over to you.
Great, thank you, Colin.
Should I pass it back to you, or do you take it from me?
I'm going to steal it back from you right now. Okay, I've got it. So thank you for that. So at the end of the day, for everybody on the call, we're really a behavior change company. That's what we do. Sure, when we're at a finalist presentation, we're maybe up against another telehealth provider or whatnot, but at the end of the day, the big differentiator for us is we educate the employees. We invest a massive amount of resources into the company, into the group, to educate and train and steer them down the most efficient path to care. When you do that, that's when you get those numbers that are extremely high for our industry, like the 42% utilization. If you're a company, and you should be hoping that you have a lot of HealthiestYou utilization. It's the opposite of healthcare. Healthcare, you really kind of want to drive down utilization because it's very costly. With HealthiestYou, you want to drive it up in HealthiestYou, because as one of our large payer partners did an in-depth analysis of HealthiestYou that's embedded into one of their health plans. And at the end of the day, every time somebody called HealthiestYou, it saved that health plan $293. So at the end of the year, we're going to redirect more claims, save you more money than you're spending on HealthiestYou. Now, I brought up the screen here to show you our reporting tool to kind of explain how this works. This is a new reporting tool we have. Nobody else in the industry has anything like this, okay? This is what our client success team references and uses every day when they're working with the admins of companies and getting the education and awareness out about HealthiestYou, but they're also tracking utilization. So this group here, as an example, they have 2,751 employees today that are on HealthiestYou, that have the health plan. Starting 1/1, they like the product so much, they're buying it for all the employees that don't have HealthiestYou because they didn't take a health insurance coverage. That'll be 5,500 total employees because it's so valuable for retention, morale, absenteeism, productivity, that they said, you know what, we're buying it for all employees. They've done 974 consultations to date. They're already at 35% utilization. Now, we have a few more large utilization months, and this is just through November. They're going to be well into that 40+% utilization number, which means massive savings. So let's crunch some quick numbers here for this group to show you what that means. So these are redirection rates. When people call in or when they use the app, we ask them, what would you have done if you didn't have HealthiestYou? Would you have gone to the primary care doctor, urgent care, or emergency room? So this group here, they've done 317 emergency room redirects today. The company's paying an average of $1,400 for every office visit. They're a self-insured group, right? That's $443,800 in savings just looking at the emergency rooms alone. So if they have 2,751 employees, okay, whoops, and they're paying, let's just say $6 a month for this. They're spending $198,000 for HealthiestYou for the year, but just in the emergency room alone, they're saving $400,000. We're not even talking about urgent care and primary care yet. So this group is saving far more than they're spending for HealthiestYou. So we like to have that data to share back. On the left-hand side here, top 5 reasons that people are calling in. So acute sinusitis, respiratory infections. As the seasons change this time of year, come January, end of December, it's going to be flu, right? Top 5 prescriptions that were suggested by the doctor. The call times. There are some telehealth providers that do video only. Well, 48% of the people in the country don't have the ability to do a video consultation if they wanted to. So you're wiping them out. They're maybe doing limited times. Maybe they're only going until 10 o'clock at night. Well, this group's doing a third of their consultations between 10 p.m. and 6 a.m. Very, very valuable having that 24-hour solution there. Here's the top 5 locations by consultation breakdown. So this group has multiple offices across the country, and you can skim over and see where those consultations are taking place. So there's a lot of data there for the admin and for you all as the consultant or broker working with them to share back and show them why telehealth in general is the fastest growing sector in healthcare, but why HealthiestYou is the leader in that sector because we get the highest utilization. So I hope that makes sense there. We remind everybody, feel free to use the chat box or the questions box on your GoToWebinar control panel. If you have any questions, shoot them in here. We got Jesse and some other team members that are responding and answering those questions. And at the very end, we'll probably pull some of those questions out and answer those for everybody on the call for educational purposes as well. So when you get that utilization, what happens? Here's a couple of case studies. 146 employees in this group drove down their primary care, urgent care, and ER spend by 37% their first year. They had 2.2 fewer PTO days per employee that first year. They kept $31,000 in unnecessary claims out of the health plan. Here's a school district, 5 schools in this district, 225 employees. Every year, they're getting that standard 10 to 20% increase in health insurance costs. Not uncommon across the country. What's that mean? The superintendent has been very upset because he has not been able to give his employees raises or bonuses because all that money is going to healthcare spend. First year with HealthiestYou, almost 87% utilization. He got very passionate about this. They got their renewal back, -2% increase in their health insurance because why? They're doing so many HealthiestYou consultations in there, the costs are going down. Guess what he did? He took that savings, he bonused his employees. First time in 5 years he was able to do that, brought a tear to his eye being able to do it, but he thanks HealthiestYou for being able to do that because it shifted the way we resolve our healthcare spend. Here's one more quick case study. 2,200 employees. They did over 1,000 consultations with telehealth their first year. They kept well over $214,000 in claims out of the plan, reduced urgent care spend alone by 37%. Guys, HealthiestYou is not a nice to have for your groups. It's a necessity. We got to put this in. We got to start talking about benefit plan design. The way to do that, I created a slide from interviewing our top producers across the country, and the very high retention rate with these groups. They keep renewing over and over and over again because HealthiestYou is so valuable. They lead with HealthiestYou. You give that to the employees first. Why? Well, it's differentiating you from everyone else in the space, but most importantly, that's where they're going to go for 70% of their healthcare needs, and it's free to them. There's no consultation fee. So they got that concierge doctor network that's waiting on them instead of them waiting on the doctor in line at an urgent care center for something that can be taken care of right from their desk at work or at home. 24/7 physician access. They sync their health plan, find providers, see their deductible, save money on medication. We're going to hear a great testimonial here in a second about that. Next, you wrap the major medical around it. If you're going to HealthiestYou for 70% of your needs, what's the appropriate major medical fit? That's your expertise. You guys know all the plans you have access to. Do you go self-funded? Do you do a PPO, HSA? What's the fit? Use your expertise, wrap that around it. If you like the supplemental medical products, great fit for them. GAP plans, critical cares, hospital indemnity. If you like those, talk about those next. Then down to your ancillary, your dental, your vision, maybe an ID theft. Then down to your financial. But HealthiestYou is the core of that benefit offering. It's the lead product. It's where the consumer goes. We're going to steer them down the path. It's now a necessity of the benefit plan design. Our most productive and successful partnerships across the country, they put HealthiestYou in every single quote going out the door. And it's very rarely does somebody say, I don't want HealthiestYou in there. They're very excited about it. They keep it, and it's a great fit. So it doesn't matter if you're fully insured, you're self-funded. Half of our book of business, we have over 6,000 companies now on HealthiestYou. They may range from 5 employees to tens of thousands of employees. Fully insured is half of our book of business. Self-funded is the other half. ACA plans, great fit. If you're doing any MEC business, the minimum essential coverage plans, it's a rapidly growing business here at HealthiestYou. We're fit well with payers, TPAs, associations, rolling out some very big association business right now. As long as there is a person that needs health care on the other end, HealthiestYou is a great fit. Let's look at pricing here real quick. Then we're going to jump into some testimonials and an awesome giveaway here for some memberships for this holiday season. Pricing is tiered by group size. 2 to 99 employees, $9 PEPM per month. We've got a 15% commission built in there for the broker, for their time and effort putting that in, making that happen. There's unlimited consultations for the member. They can call in as much as they want. They're never going to get hit with a consultation fee. They can price medications on there, find providers. They get the app for free. It's all included. And we have groups coming in every day in this 2 to 99 category. Love and Healthiest You, and they're renewing it. You go up bigger here, 100 to 249, you drop to 8, 250 to 499 down to 7, 500 to 99, 6. Anything over 1,000 employees. Let's do a custom quote on that. You can sell it at 6 if you want to, but we'll look at that opportunity, see if we can sharpen that pencil up and come in with an aggressive offering for those larger groups. The reason the pricing goes down with group size, typically the larger the group, longer it may take to get some utilization in there, more people to educate. So utilization can be lower on the larger groups. It can vary. Voluntary, individuals 11, families 15. Same rules apply. Unlimited consultation, same commissions. They get unlimited access. It's all in there, ready to go. So now let's jump to a couple of testimonials. So we have some guests on the line here. We have 3 guests, and I think we'll start off here. We have Mo, Christy, and Judith on the line today. And Mo, why don't you go ahead and unmute your phone here? You've got a great story I think will be good to share with everybody in the audience. Mo, are you on the line?
Can you hear me okay, Scott?
We can hear you good. We got some kind of weird beeping in the background, but I think overall we can hear you good.
Okay, very good. This is Mo, and I'm going to let everybody know that I've had HealthiestYou now for my family for over 3 years. We've used it quite often. One particular instance that I thought was somewhat comical. I have an older son going to college. He came home for Mother's Day weekend to surprise his mom. And he walked into the house, and I take one look at him, and I say, "What happened to you?" He says, "I got double pink eye, and all my ears are plugged up. So I'm going to run down to urgent care." I said, that may be necessary, but why don't you hit the app on your phone first, talk to HealthiestYou, and see what they have to say. So, of course, being a teenager and having his phone on speaker, I could listen to the whole conversation. So he explains to the nurse who took his call what's going on, states that the doctor will call him back shortly, and literally I hear his phone ring back in about 2 minutes. And I hear the conversation with the doctor, and the doctor says, "Dude, I understand you just came back from college and you're pretty sick." And he says, "Yeah." He said, "Well, I'll tell you what I'm going to do is I'm going to write you 2 prescriptions, one for your eyes and one for your ears. And I see that you've used HealthiestYou before. There's a pharmacy right down the street from your house. So I'm going to have those prescriptions sent over to your pharmacy, and they'll be ready shortly." And I also heard him explain that, "I understand here on your medical record that you're allergic to amoxicillin, so what I'm going to do is I'm going to write you an alternate. I'm going to write you a Z-Pak, so you don't have any issues with that medication." And as soon as he got off the phone, we used the app on his phone to check the discounted RX, and the Z-Pak was $13 with the coupon, and the eye drops are $8. Now, you have to understand that I'm on a high-deductible health plan. It's an HSA. So any pharmacy, any doctor visits, any services would go to deductible and co-insurance. Well, we resolved that whole issue within 2 hours for just a little over $20. And still a member these days. Very happy.
Wow, great story. Thank you so much for sharing that, Mo. And Mo, you know what, we invited the 3 people we invited on today. One is a broker member, one is a member, and one's an admin member that has the company has HealthiestYou. Mo has done an incredible job at selling HealthiestYou. You have, gosh, I don't know how many thousands or tens of thousands of lives that you put on HealthiestYou over the years, but it's been, you know, a great impact to your business as well. And as you can see, Mo's very passionate about the product with those personal stories. So, Mo, thank you so much for sharing that today. I really, really appreciate that. Okay, next we have Christy Anderson, who is a member, and she has a great pharmacy testimonial. Kind kind of like Mo had just shared, where she had used the app to get a great price on medication. So Christy, are you on the line?
I am.
Great. Well, thank you so much for joining the call, and appreciate you taking time out of your busy day, because we know you're busier than heck there with your consulting job. But thank you again for taking time out. Share with your story real quick on how you save money with the HealthiestYou pharmacy pricing engine.
Sure. So I had a health savings account as well with a high deductible that hadn't been met. I was leaving my doctor's office and took my prescription to a local Walgreens. Again, I'm a cash paying customer since I had the HSA. And my drug came out to $120, which I thought was very high. And that was using my discount program that was on my insurance card provided by my company. So what I did is I logged into the HealthiestYou app and searched the price prescription, put in my drug name, the dosage, and it showed the 6 closest pharmacies and prices. I ended up leaving Walgreens with my prescription and going across the street to CVS, and I only ended up paying $19.99. So I saved $100 just by logging into the app to search prescription prices.
Wow, that is awesome. How hard was it to price that medication out?
Oh, it just took, a couple minutes, even that. Very easy.
So an extra 2 minutes there to save $100 right across the street at another pharmacy. That's amazing. What people don't know, the average consumer doesn't know, is every pharmacy has a different negotiated price on medications. They have loss leaders, they have medications they make money on, and they have this formula. So one pharmacy may have amoxicillin for really cheap. The one across the street may have amoxicillin for 4 times higher. It's really a crazy business. So what we did with our pricing engine is we created relationships with multiple PBMs across the country. And it's kind of like an Amazon experience or eBay. You shop one medication, it prices all those PBMs, sorts it out by location, by price, and finds the best deal for you in a matter of seconds. Now, I personally, I've got 4 children and a spouse, 6 people in my household that are covered under insurance. And over the last 5 years, since I've had the HealthiestYou, or probably even more than that now, the HealthiestYou pricing engine, we've never run a pharmacy claim through our health plan, because I can always find a better deal on the medication for the medications that we've needed for my family through the HealthiestYou app. So think about this. Everybody that has HealthiestYou is kind of the dream customer for a payer or an employer group. So we basically do virtually 0 doctor visits per year. We do our well visits per year. Everything else is done over the phone. And we have no pharmacy claims hitting our plan. I mean, if that's not a dream customer, we need to duplicate that story and that message across the country by getting HealthiestYou in the hands of our members. Christy, great story. Thank you so much for joining. Appreciate you sharing that today. So lastly, we have Judith. She's a Human Resources Director here for a company that is a customer here at HealthiestYou. She's been an awesome partner at help getting the message out to her employees. But Judith, you've got a great story on how HealthiestYou has helped you. Can you share?
Yes, yes. Can you hear me?
We can hear you good.
Good. Okay, so Colin came out. I actually went through my emails just to make sure I'm giving you the right dates, because it took us some time to make the decision. Colin came out in March of this year and did the presentation, and none of us, the general managers or CFO, the owner, had heard of telehealth before, although looking back now, I'm surprised with as much as telehealth is in the news. And so after Colin left, we all decided as a group that this was probably too good to be true, and it was given to me to run with it and see what I can find, what information I can find, if this is legit, who are HealthiestYou's competitors, and reach out to them. And I started following telehealth information in the news, and so it took us a while to make the decision. We actually came on board with HealthiestYou October 1st, and I'm not telling you that because I'm proud of it, but we did our due diligence 1,000%. And the major reasons we decided to go with HealthiestYou is the utilization information. Other companies may say, well, they can do $4 an employee. That doesn't matter if employees don't use it. We also, I went online and I did research on other competitors, and the information online, I mean, even if you go to social media, to us, it's very important. We're big social media users, and if a company has, if 40% of their feedback reviews online are 1 stars, that's really, that meant a lot to us. That's not someone we would want to do business with. I read a lot of reviews, and from employees that were put online, other employees of other companies, and employees were not happy with other companies because they had to pay to call their telehealth service, so they paid a copay, and then they were told they had to go to their own doctor. This is not the kind of service that we wanted to give to our employees. We wanted to make sure that if they call, they can get help and not pay twice. So that's some of the due diligence that we did, and then we 100% decided to come on board with HealthiestYou. We did a lot of prep because we thought, okay, if we're going to pay for this as a company for our employees, we have 270 employees, we want to make sure that they use it. So we decided, the month before we came on board, we're going to roll it out at our luncheon meetings. We did meetings after working hours for employees and their spouses. We send out marketing information to them. We showed them how to enroll. We showed them how to use the app, how to find a doctor. I actually demoed HealthiestYou in our meetings, and I hit call a doctor, and they called me back right away. I mean, within 5 seconds, I got a call back from HealthiestYou. The nurses call back. So I demoed how it is to call. We are constantly putting out marketing information that we get from HealthiestYou. There are flyers everywhere in every department, on every fridge, in every break room. There are HealthiestYou flyers. I send information in our emails, and not only in our newsletter emails, but just random emails saying, hey, here's some information. Have you downloaded the app yet? So we've really jumped in 100%, and I think the first 33 days that we had it, there were 15 employees that had called. They called for just those regular things that you would go to the doctor for, but they would have gone to the ER or urgent care because of the timing of when they were calling. If you're calling in the middle of the night, you're going to go to urgent care. And every employee that has come to me has absolutely loved their experience. They all said they've been under 20 minutes. I know I called myself once. It was on a Sunday at 7 in the morning. So I called, I knew what was wrong, and I actually took a screenshot on my phone. From the time I called HealthiestYou, it was 20 minutes. In 20 minutes, I already had a text from my pharmacy that said my prescription was ready. That's shorter than me driving to my doctor. So our employees are 100% bought in. They love it. They're telling one another what a great resource this is from us. This is just a health perk, and we just love it. So I'm just sorry it took so long for us to come on board, but we're definitely on board now.
Well, that's awesome, Judith. Thank you so much for sharing that story. And it's okay if it takes you a little bit longer to come on board and do your due diligence. We're fine with that. We're always here to support you. But thank you for being a great partner, because we do really appreciate the admins that are passionate about their employees and getting the message out. That helps, our client success team, who works real close with you, when we have somebody like yourself that's passionate about it, that helps drive utilization and awareness and education. So thanks for helping spread the word. And thank you for joining the call today. I really appreciate it. But again, that's what keeps us going here at HealthiestYou, are the stories like we just shared with you, that just keeps us so excited about what we do. I think of I share this once in a while with some stories that have come in with we do a lot of school district business across the country as an example, and as an industry as a whole across the country, they're getting hit with budget crunch demands. They're having to cut back expenses, and they're cutting back benefits, and they're not giving raises in a lot of situations because of state budgeting issues. But when you get those calls from the teachers that are on tight budgets. Maybe they're one I can think of is a single mom that's got a couple kids, and it just is so, there's so much involved with taking that child to the emergency room on the Sunday night at 11 o'clock, finding a babysitter for the other kids that are at home, waiting in line for 3 hours to get in there for your child that's got, something that is miserable to them, like pink eye, but that can be resolved so easy using the proper resource like HealthiestYou. So when we call it the old me and the new me here at HealthiestYou, the old me would have called the babysitter over, went over, stood in line for 3 hours with your child to get that medication for the pink eye, then come back, spend $1,000 on it. The new me is, well, you call from the comfort of your home, just like Judith had shared. You get on the phone with that consultation, resolve the issue, pick up the medication, and you're on your way with your day. So that's what really keeps us going. So I want to thank everybody for joining the call. Next, we are going to draw some names. And Jesse here has put a bunch of names, all the names of people that have attended here today, into a big bucket and pulled out 10 names, correct, Jesse? So we're going to give away about $1,800 worth of annual HealthiestYou memberships here for our guest today to give away to somebody in need. So Jesse, let's go ahead and announce those names.
All right, thank you, Scott, and thanks everybody for your attendance today. We hope you all had a great Thanksgiving, and thank you so much for your partnership. So you'll be receiving a message from our team, but just to list off those that have won, first up, Heather Ware-Nelson. Congratulations, Heather. Next is Steve Ward. Thank you, Steve, for being on today. Next, Amy Bagnasco. Thank you very much, Amy. Next, Joseph Saavedra. And Joseph, I'm sorry if I butchered your last name, but thank you. Next up, Karen Grace. Thank you, Karen. Number 6, Linda Ogilvie. Thank you, Linda. Number 7, Andrew Lane. Thank you, Andrew, for attending today. Number 8, Mary Ivins. Number 9, David Middlemas. And last would be Richard Everding. So thank you all so much for your attendance. And again, we will be in touch, passing along some information that you can share with whomever you choose to provide a year membership to HealthiestYou with.
Awesome. Well, thank you so much, and congratulations to those that won the membership. 10 of those were given away. So we will reach out to you and walk you through the easy process of how to register the person that you want to give that to, or if it's for yourself, for your family. We'll show you how the simple process is to register. Now, for those that want to hang around here a little bit, we have some questions, I think, some good questions that have come through on the chat box here on the GoToWebinar control panel. So we'll address some of these. There's a couple questions that came in around the pharmacies. So I think when Mo gave his story there, they sent the medication over to the pharmacy they usually use, but then he checked the medication on his app. Now you can do this too before they send it over. That's what I do, is before the doctor says, hey, what pharmacy? I see your preferred pharmacy is X. You want me to send it over there? And I usually go, well, hang on a second, let me just price it real quick on my app. No, you know what? That CVS on the street's cheaper. Why don't you send it there? You can do it that way, or if they do send it over, that's okay, and you happen to find a better price one. Tony here at HealthiestYou has got a great story around this. He's done this a few times actually, where you just call that pharmacy up and you say, you know what? Can you send it over to CVS? Pharmacy says, sure. They send that right over. So that pharmacy can send it over to any pharmacy of your choice. You don't have to keep it there. It's a real easy one phone call or pop in and just have them send that over. So hopefully that answers the questions around the pharmacy side. Here's a question: do you have to have a health plan in order to use HealthiestYou? Good question. You do not have to have a health plan to purchase HealthiestYou or use it. It just fits nice next to a health plan because that's typically how it's sold in a group setting. But no, you've got a neighbor that loves the HealthiestYou product because you were talking about it and they want it. No, you can sign them up and they can buy it for themselves and family, and whether they have a health insurance plan or not. It's not tied to health insurance in that sense. So you can buy it. It's easy to do that. Now, we encourage you to go to HealthiestYou.com and log into the partner portal, create your account if you haven't done so. Lots of great tools there. Email marketing, automated webinars, flyers, PowerPoint presentations, everything you need to be in the HealthiestYou business is there. I'll kind of show you what this looks like. Go to HealthiestYou.com, click on this access button, partner portal, create your own account, Okay, you log in, it looks like this here. You've got your dashboard, so you can see all the proposals that have gone out. The activity feed, you can do ROI calculators, right? These are fantastic. So you got a self-insured group. You want to ice the cake on this sale, very easy to do. Put in the number of employees. You don't need to put in the dependents because we're going to include those in our pricing. Let's say we price this group at $6 for the entire family, $6 per employee per month. Let's say they're doing 3,000 doctor visits per year. We'll just kind of use some average numbers here. Let's say they're doing 1,000 urgent care visits and 800 emergency rooms. Okay, and the average cost per visit. Let's say primary care, well, again, use some averages, $125, urgent care spend at $175, ER at $1,400. We'll use that one group's average. And let's say you just redirect 10% of those claims. So you're doing, that's 480 visits that we're going to redirect to HealthiestYou instead of going in. Here's the cost per location. You're spending $72,000 for HealthiestYou for the year, but you're redirecting $167,000 in claims. You're getting 132% return on your investment in 1 year. That's phenomenal. And it's a very common and average situation for groups that we see, especially in our self-insured book of business. Here's the breakdown by location over 3-year savings, reduced absenteeism, the environmental impact, CO2 footprint, right? Because we know it's a 16-mile average trip to a doctor with a 2-hour wait. There's the mileage, fuel savings, CO2. And you go back and say, you know what? Maybe this group is going to underperform. Let's say they're not good communicators to their employers, unlike Judith here, who's done a great job at communicating to her employees, and she's getting huge utilization first month. Let's say this is a very underperforming group in our book of business. They're only doing 24% utilization. They're still got a nice 16% return on their investment. They're spending $72,000. They're saving $83,000. So it's kind of that no-brainer here. Even if you fail on the utilization year 1, which year 2 and 3 are going to continue to increase, you're still redirecting more claims than you're spending. So great tool here in our partner portal. Register for that. Email marketing, calculators, marketing pieces in here, flyers, everything you need to get you in the business. And most importantly, call us here at HealthiestYou. We're here to support you. Go to the website here at the bottom. Here's our how to reach us, our direct line, our email. We have a full support team here that's all they do is they do presentations for you. We do webinars every single day, all day long, for your groups on your behalf, sharing HealthiestYou, doing an app demo. Get the membership for yourself. You can buy it at a 30% discount right on the partner portal. Everybody I talk to that's selling the heck out of HealthiestYou, the consultants, they pull up their phone and they say, this is what I do. I show my clients the app on my phone and say, you got to have this for your employees. Look how awesome this is. And that's how they sell it. It's that easy. Walk them through the app and say, there isn't anybody that says, wow, I don't want that. Why would why would you want to make your healthcare easy and save money? Of course, everybody wants that. Show them the app, use the membership yourself. It's a must-have. It'll save you and your family a lot of money and time and resources. But share that with your clients and customer base as well. So I think there's a few more questions here we can jump back to here. Let's see. Can a person download the app and search around before they are an actual member? No, you have to be a member to get into the app, take a peek, search around, use it. Again, you get a 30% discount as a distribution partner. It's really inexpensive. Buy it, get it, use it. How does the app pull your deductible balance? Just by inserting my insurance information. It's called Automagically, the term we use here at HealthiestYou. We build a system that's connected to 170 different payers, real time. It sees your deductible, so if you log into your payer site, what's your deductible showing? That's what it's going to show you on the HealthiestYou app. It does not log into your site for you. It doesn't screen scrape anything. These are API feeds connected to the payers that have that data, pulling it on your behalf, real time, right into the app. Works awesome. Okay, let's see what else we have. Here's a question around health insurance. Good question around some health insurance plans have an embedded telehealth solution. Great. They've been doing that for 8 years now. Guess what? It doesn't work. The average utilization in the plan is 1%. Nobody knows it's there. You got to pay an average of $40. Sometimes you're lucky to only pay $10. Most of the time it's between $40 and $50 to do a consultation fee. Nobody knows it's there. Nobody knows it exists. Nobody wants to pay the money. Nobody uses it. So we have a lot of groups across the country that have an embedded solution in their plan. Doesn't matter. They buy HealthiestYou because they want one that works and integrates everything. It's their health ecosystem. They can see their deductible, find providers, find the best prices on medication. Docs are waiting. Everything's there. The ones in the plan, they don't have any of that, right? And you got to pay to do it. It's a nice check-the-box solution. It doesn't work. There's no ROI there. So it's an easy one to sell against. Is there an age limit for seniors to take advantage of HY? We do not age discriminate. If you're 105 years old, you can have HealthiestYou. It doesn't matter. As long as you're 18 years of age or older, you can have your own HealthiestYou membership. It's great for everybody. Okay, let's see what else we have. Can they be on Medicare or Medicaid and still have HealthiestYou? It's a great fit if you have Medicare or Medicaid. Absolutely. You need HealthiestYou if you have Medicare or Medicaid. No question about it. Let's see what else here. If there's a company that maybe like a local smaller health system or a TPA that has a unique network on the doctor side that may not be loaded in the app, is that a problem? No, what we do with those groups is we just pull that data in. So we have a lot of TPA relationships. They've got their own network or a unique network. No problem. We get the data feed from them, connect it up, and off we go. Okay, let's see. Some of these, I'm going through these questions, but some of these are duplicated questions we've already answered here. This one's again on the RX transfer to another pharmacy. Can the doctors call in refill medications? Depends on the medication. These are maintenance medications, primarily where this question is surrounded around. They can, depends on the medication, depends on the patient situation. We have a lot of scenarios where somebody's traveling, they stayed longer than they thought, ran out of medication, lost baggage, I need some temporary medication refills. Many times we can do that. It depends on the medication and the patient's situation and so on in their medical history that is filled out by them. Good question. Okay, without a health insurance plan, how beneficial is HealthiestYou? Well, extremely beneficial. If you're going to go in and pay cash for a doctor visit or an emergency room visit, it sure would be nice to have those HealthiestYou visits at no cost, just the cost of your monthly membership fee. You use it one time, you've paid for itself. And if you find some better prices on medication because you're paying cash for medications, HealthiestYou can be a tremendous value for those that don't have a health insurance plan. Okay. Can churches or organizations qualify for group rates? Absolutely. As long as there's one bill going into that group, we can satisfy the group payment on that. They don't have to have health insurance as well. If you have a dependent on a different healthcare plan, can you have two profiles within one app? So your dependent's actually going to download a second app if they're over the age of 18. So if it's a spouse, they'll have their own app. If they have separate health insurance coverage, they'll put their health insurance information in. If you have a child under that dependent with a separate health plan coverage than what the primary has, you can only have one health plan in one app, if that makes sense. What is dependent child age limits? We follow the same basic rules around ACA and health insurance plans up to the age of 26. So you got a college student, maybe they're 22 years old, they're away at college, they'll have access to HealthiestYou under the family membership. Okay, I think we hit most of those questions and we're right at the hour here. So any other questions you have, please email us at support@healthiestYou.com here, support@healthiestYou.com. You can call us 480-779-4360, 480-779-4360, or support@healthiestYou.com for email. Thanks everybody for joining the call. Congratulations to our winners today. Love to hear the stories. Let us know what you're doing with those memberships. You're keeping it for yourself because you want to sell more HealthiestYou? Awesome. You want to give it to a family in need? gives us the holidays, and it's that time of year. Awesome. Let us know what you do with it. We hope you enjoy that, and thank you everybody for joining, and thanks to our guests for sharing those awesome testimonials. So appreciate every one of you. Look forward to working with you. To those that we haven't yet, have a great holiday season, and thanks again. Take care.